When should you start testing for pregnancy? First, let's talk about implantation, which typically happens around 5 to 6 days after you have ovulated, fertilization has taken place, and then the tiny little embryo travels to the uterus to implant. So that first week of your 2-week wait, typically you're not going to see a positive pregnancy test because the embryo hasn't even made it to the uterus yet. Once implantation happens, it then takes a couple of days in order for the pregnancy hormone HCG to start rising, which you can then pick up on an at-home pregnancy test. Taking all of those days into consideration, you may end up with a positive pregnancy test around 9 or 10 DPO, but that doesn't always happen to everyone. Sometimes it can take a little bit longer, including myself. I did not get a positive pregnancy test until 13 DPO. So when should you start testing? You absolutely can take a test at 10 DPO if that's what you want to do. However, I personally recommend waiting until closer to 12 to 14 DPO, or even when you're due for that period before you start testing.